What causes teething rash? If you're a parent wondering why your baby is developing a rash around their mouth, chin, and neck, you're not alone. Let's break down what's really going on. When your baby starts teething, it's a significant milestone, but it can also bring some discomfort and skin issues. The key to understanding teething rash is to look at what happens during the teething process. As your baby's teeth begin to move through their gums, they start to produce more saliva. This increased salivation leads to drooling, which is a common sight during teething. The constant flow of drool can accumulate around the mouth, chin, and sometimes even the neck and chest. Here's where the problem starts. This drool can break down the skin's protective barrier. When the skin stays wet for too long, it becomes more susceptible to irritation. This irritation manifests as a rash, often characterized by small, raised, red bumps and dry, chapped skin. In addition to the drool, other factors can make this rash worse. Friction from bibs, pacifiers, or even your baby's clothing can exacerbate the skin irritation. For example, if your baby uses a pacifier, you might notice a cluster of drool rash on the skin that touches the pacifier. Bacteria from the drool can also play a role. When the skin is already compromised by frequent wiping or rubbing, these bacteria can further inflame the skin, making the rash more uncomfortable for your baby. It's important to note that not all babies will develop a teething rash. The likelihood depends on how sensitive their skin is to moisture. So, while teething and rashes are often linked, they don't go hand in hand for every baby. To manage this rash, you can take a few simple steps. Using bibs to catch drool can help reduce the amount of saliva that comes into contact with your baby's skin. Gently wiping their face and chin to keep the area dry is also helpful. Be careful not to overwipe, as this can make the skin feel more sore. Applying a barrier cream, like petroleum jelly, can protect the skin from further irritation. These simple measures can make a big difference in keeping your baby comfortable during the teething process. Remember, if the rash becomes severe, spreads, or is accompanied by other symptoms like fever, it's a good idea to consult with your baby's doctor to rule out any other skin conditions or infections.